Central venous catheters, or CVCs, have long been associated with a high risk of infection in hemodialysis patients, posing a risk of catheter-related sepsis in this population. The current practice is to disinfect catheter caps while in place before accessing the CVC for a dialysis treatment. The 2013 Centers for Disease Control Scrub the Hub guidelines recommend to disinfect the hubs of the CVC with caps removed using an appropriate antiseptic. This procedure requires the catheter lumen end to be open to air while handled by the caregiver, increasing the risk of contamination. Opening the lumen also increases the risk of the antiseptic or disinfectant entering the catheter. The Angelini Pharma See Luer Cap is a single-use disposable cap system. Its innovative design allows for complete disinfection of the CVC exposed threads, permitting full access to the limb threads while occluding the CVC's high-risk inner lumen during the disinfection step prior to dialysis treatment initiation. When not retracted for disinfection, the Angelini Pharma See Luer Cap functions as a typical catheter end cap, occluding the threads and inner lumen of the CVC limbs securely between dialysis sessions. The Angelini Pharma See Luer Cap addresses infection prevention in an elegant and simple manner. The procedure for the application of the Angelini Pharma See Luer Caps is as follows. To access the threads for disinfection preceding dialysis treatment, carefully twist the See Luer Cap counterclockwise and slide the cap back until the CVC limb threads are fully visible. Disinfect the threads per clinic procedure using an appropriate disinfectant, such as Alkavis 50 catheter disinfectant. Once the CVC limb is fully disinfected, simply remove the cap by pulling it off the CVC limb. Limit exposure time of the open CVC limb end and aseptically connect the CVC limb to a syringe or dialysis tubing and initiate treatment. Discard the used See Luer cap. The procedure for the application of the Angelini Pharma See Luer Caps following dialysis treatment is as follows. Disinfect the CVC limbs according to treatment protocol with the bloodlines still attached. Using aseptic technique and wearing appropriate personal protection, open the See Luer caps. Carefully remove the white cap cover on the See Luer cap. Gently push the See Luer cap into the open lumen end of the CVC. Twist each collar clockwise to tighten the cap and cover the threads. Repeat this step on the second CVC limb. The cap will remain securely in place between hemodialysis treatments. It is not recommended taping the See Luer caps onto the CVC limbs, as this will make future disinfection more difficult. The Angelini Pharma See Luer Caps provide a simple, elegant, and effective solution to reduce contamination risks during hemodialysis treatments. Contact Angelini Pharma or your dialysis provider for more information.